time, I'd like to recognize the Vice Chairman of the Congressional Black Caucus, a leader on a number of key issues that the Congressional Black Caucus is facing this 113th Congress, the gentleman from North Carolina, Mr. Butterfield.
Let me thank you, Mr. Horsford, for yielding time this and thank you for your leadership, not only here in the Congress, but in the Congressional Black Caucus. You have come to this Congress and you have done so much in such a short period of time. Thank you, Mr. Jeffries and Ms. Fudge as well for your leadership. But, Mr. Speaker, I want to start this conversation this evening by talking about a 1985 report. President Ronald Reagan was president at the time, and the U.S. Department of Health and Human Services issued a statement. They called health disparities in the United States of America an affront, both to our ideals and to the ongoing genius of American medicine. It's disgusting, Mr. Speaker, that in this year, 2013, health disparities still exist in the richest and most powerful country in the world. African Americans are disproportionately less healthy. Life-threatening diseases like high blood pressure and diabetes and heart disease are ravaging our population. Oftentimes, African Americans that live in rural communities like the one that I represent in North Carolina don't have insurance, and they have difficulty finding a regular primary care doctor, and so they go without an annual physical or regular checkups. Sometimes their only interaction with a health care provider is when they call 911 because their unchecked blood pressure resulted in a heart attack or stroke. By then, it's too late. If that same person, Mr. Speaker, suffering from a stroke would have access to care, their high blood pressure may have been diagnosed early. They may have been put on medication meant to regulate their condition, making a heart attack or stroke less likely. Many African Americans do play an active role in their health care, but the quality of the care they receive can be much worse than their white counterparts, further widening the gulf of disparities. A significant driver of these disparities is the lack of health insurance, and that's what the gentlelady spoke about a moment ago. African Americans make up 13% of the entire population, but account for more than 50% of all people who are uninsured. African Americans are also likely to have disproportionately lower access to primary care and often receive poorer quality care and face more barriers in seeking treatment for chronic disease management. The Affordable Care Act that we are all so proud of was designed to put a premium on quality of care, increased access, and encourage and reward good health care outcomes. I am a strong supporter of the Affordable Care Act, and my constituents in North Carolina are as well. Every person should have access to affordable quality health care, regardless of who they are, where they come from, and how much money they have in their bank accounts. Before the Affordable Care Act was signed into law, 50 million people lived without health insurance. An additional 38 million people had insurance, but it was woefully inadequate and charged them exorbitant co-insurance payments and huge co-pays and completely unmanageable out-of-pocket expenses, essentially making them uninsured too. That means nearly one-third of all Americans were without the very basic insurance needed to see a health care professional and receive care at an affordable price. When President Barack Obama proposed and congressional Democrats introduced the Affordable Care Act, Republicans stirred up for a battle. They would scream in the town hall meetings all across the country and even right here on this House floor about how the bill would create death panels who would decide if a person was worthy of receiving treatment for a particular disease. That was not correct. They would insist that the bill would gut hundreds of millions of dollars from Medicare. Not correct. In fact, the Affordable Care Act specifically prohibits cuts to the guaranteed Medicare benefits. They would bring out charts on this floor and graphs that showed how the Affordable Care Act would be a job killer, worse than we have ever experienced before. That turned out to be a lie. The cost of health care has risen each year. Insurance coverage has decreased each year, and the amount of uncompensated care has increased every year. Mr. Horsford, here's a statistic that really stands out with me. In 1970, the United States spent $75 billion on health care. That was 7.2% of GDP. In 2010, Health care spending represented 17.9% of GDP, and if not for the Affordable Care Act, was expected to reach 20% by the year 2020. The U.S. spends more of its dollars for health care related expenses than any other country in the world, and the uncontrolled rise in the cost of health care would have been completely unsustainable if not for Obamacare. President Obama signed the Affordable Care Act into law, and with the stroke of a pen, revolutionized health care in America. Insurance companies can no longer deny coverage to people with pre-existing conditions or charge them more than anyone else. There's now no lifetime dollar limit on what insurers will pay for claims. Preventative visits to health care providers are now free. Yes, free. And even include some free vaccinations. Young adults can now stay on their parents' policy until they are 26 years old. And all new group health plans now have to cover all recommendations by the U.S. Preventive Services Task Force. Now, millions of people in our country and in my congressional district, and Mr. Horsford, in your congressional district, who were living without the most basic health insurance can benefit from the most advanced health care technology in the world. My only disappointment, Mr. Speaker, is that some of our Republican governors and state legislatures across the country are refusing to participate in the expansion of Medicaid. Shame on them. Mr. Closing, I am confident that because of the Affordable Care Act, the delta of health disparities in America will begin to shrink. No matter the color of your skin or the amount of money you have, each and every American deserves high-quality health care so they can live long and prosperous lives. Mr. Horsford, I thank you so very much for yielding time. At this time, I will yield back my time.